Hello, good evening. My name is Dr. Chudi Ufondo of Snowspirations Global Health Solutions. How are you? I hope you had a wonderful evening and you had a wonderful day and you're doing great. This evening, we're going to talk about painful menstrual bleeding, which is also called dysmenorrhea. So, what can likely lead to painful menstrual bleeding? What is the indication of painful menstrual bleeding? How can it affect your fertility? And what is the best management of painful menstrual bleeding? What types do we have? What can actually lead to this? If you're currently having painful menstrual bleeding, what's the indication? What does it tell? Is it a sign that your fertility is having problems, or is this something you should not bother about? So that will be the basis for my discussion this evening. So once you join, let's know who you are, introduce yourself, tell me where you're located. Then I'm going to wait for other people to join. I'm going to give my presentation. After my presentation, you have opportunity to ask your questions. Immediately after my clinic in YouTube, I'm going to repeat the same clinic in Facebook. So if you're not able to meet up with YouTube, you can always join me in Facebook. If today is the first day attending my clinic, I truly appreciate you. And please make sure you subscribe today so that subsequently you will know when I come live. My clinics, it's normally on Tuesdays about this time, 6:30 p.m. Eastern Time US, 11:30 p.m. Nigerian time. Then immediately after that, 7 p.m. Eastern Time US in Facebook, 12 a.m. in Nigeria. And we're going to correspond and you will learn one or few things. So I'm actually going to start. I'm hoping that admin will also join. So once admin joins, please follow through and we're going to learn together. After my presentation, you will have opportunity to ask your questions. So I'm going to use my teaching aid. Now, painful menstrual bleeding, it's something we need to keep an eye on. Yeah, normally, majority of women will feel some discomfort and some level of pain when they are having their monthly bleeding. Now, you might want to ask, what actually leads to the monthly bleeding? So you see, the body of a woman is structured in such a way that every month, that woman has the possibility of becoming pregnant. So the body of a woman is structured in such a way that the eggs will be released. Supposedly, the sperm will come in, get the eggs fertilized. Then afterwards, there will be implantation, and pregnancy will continue until after 9 months. Remember that pregnancy is divided into first trimester, second trimester, and third trimester. But here is the big deal. If pregnancy doesn't happen in a woman in her reproductive phase of life, so reproductive phase of life is actually when you can become pregnant. When you're done with the reproductive phase of life, you're going to enter menopause. When you enter menopause, possibility of pregnancy naturally is no longer there. So when a woman is in her reproductive phase of life, the hormones that will lead to releasing the eggs will function. And there are hormones that will go to prepare the cover of the womb, which is called the endometrium, to receive the fertilized egg, which at this stage is called the embryo. Now, if pregnancy fails to happen, so if there is no availability of sperm and the egg was not fertilized, the egg will survive for just 24 hours and it will part of what will be absorbed in the body. But there is a significant process that happens in the cover of the womb. The cover of the womb, which is called the endometrium, the top layer will disintegrate and slough off. Now, that disintegration of the top layer of the endometrium is actually what will be passed out from the vagina as your menstrual bleeding. So in some women, they will experience some level of cramping, some level of discomfort, some level of pain. This is pretty normal for a lot of women, especially if they are younger than 20. You will notice that that's the period you will likely experience dysmenorrhea. When the pain exceeds a certain threshold, when the pain is unbearable, when the pain is making you not to get up from the bed, not to go to work, to miss school, that's what we begin to worry about. That's called dysmenorrhea. The medical terminology for painful menses is called dysmenorrhea. Generally, we have two types. The first type is called primary dysmenorrhea or primary painful bleeding. The second type is called secondary dysmenorrhea or secondary painful bleeding. In primary dysmenorrhea, it will occur in women who will experience pain just before or during menses. Otherwise, shortly after that, they will feel normal. In women that have secondary dysmenorrhea, previously in the past, they had normal bleeding, no problems, just little discomfort here and there. Then later in life, they begin to develop painful period. So secondary dysmenorrhea is the type that probably might be related to some pathology, to some gynecological problems, to growth, to tumor, and all that. Primary is the one you will generally have around the time you're bleeding, which is pretty much okay. So remember, there are two types. So depending on the type you're having, it might tell us if you have a problem or not. Now, sometimes the condition is usually accompanied by problem affecting the womb or other pelvic organs. So the pain itself might be accompanied by heavy bleeding, might be accompanied by painful intercourse, which is called dyspareunia. Painful bleeding, it's called dysmenorrhea. Heavy bleeding is called heavy bleeding. Okay, so there are certain things we'll be on the lookout for. I don't want to bother you guys with medical terminology, so I'm trying to use the barest minimum of the description. So just bleeding with pain might be an indication that might be a problem somewhere, and sometimes it might just be nothing. So what are the likely reasons? What are the likely causes of painful bleeding? Some women practically we will check and everything is okay, so we won't really see the reason why they are having this painful bleeding. However, there are some risk factors. So risk factors are things that if you get exposed to, they will likely lead you to bleeding and having pain when you're bleeding. So number one is being under 20. So women that are currently under 20 will experience more cramping, more painful bleeding. That's standard. As you're getting older, generally, if you don't have any medical problem, it's expected that the pain will begin to subside. Now, if you have a family history of dysmenorrhea, so if your mom had dysmenorrhea, if your sister had dysmenorrhea, possibility you will have dysmenorrhea is very high. So it's familiar. So your mom can transfer the heavy bleeding, painful bleeding gene to you, and it's just a familiar thing. So whatever happens to your mom, to your sister, can also happen to you. If you're a smoker, remember that smoking can be primary smoking or secondary smoking. Primary smoking means you are the person lighting the cigarette, you're smoking it. Secondary smoking means you are hanging around people that smoke. Now, if you also have heavy bleeding, most heavy bleeders will present with painful bleeding. So if you pay attention, you will notice that when you're bleeding more and when you're bleeding in clot and when the number of your bleeding days is increased, possibility you're going to have more pain is very high. If you have never had a baby in the past, possibility you will also have more painful episodes of your bleeding is high. So it's commoner among women that have not given birth. When you give birth, for some reasons, your body tends to kind of adjust. Now, if you experience early puberty, so if you have a young girl who is currently 9 and she's already started developing secondary sexual characteristics, she's already started bleeding, possibility she's going to have painful bleeding is very high. So any puberty that occurs before age 11 is considered early puberty. Now let's talk about the likely pathology. So what are the details that might be leading to this pain itself? So there's a particular hormone-like substance we call prostaglandin. So prostaglandins are the structures that will go and trigger muscle contractions to help to expel the lining of the womb. Remember, the lining of the womb is called the endometrium. So from research, we noticed that when women are about to bleed, they will elaborate a lot of prostaglandins, which will go to the womb and make it to contract. And when it contracts, the upper layer will slough off and it will be passed out as part of your bleeding. Now, we notice that when this contraction happens, it can lead to pain, it can lead to inflammation, and some women might have higher levels of prostaglandin, which will mean higher level of having pain when they are bleeding. So there's a correlation between having a higher level of prostaglandin and having a possibility of having pain during your bleeding. So there is a need to have further research in this regard. Now, for secondary painful bleeding, so that's secondary dysmenorrhea. Like I told you guys, is a type of dysmenorrhea that will develop later in life. For example, when you're in your 20s, you never had dysmenorrhea. Then suddenly you're getting to your late 30s and your late 40s, you begin to experience dysmenorrhea. Likely is because of gynecological problems. So premenstrual syndrome can cause that. Endometriosis can cause that. Fibroids can cause that. Pelvic inflammatory disease can cause that. STI can cause that. UTI can cause that. So anything that affects any of these organs in the pelvic areas can lead to secondary dysmenorrhea. So premenstrual syndrome, endometriosis, fibroids, polyps, pelvic inflammatory disease, sexually transmitted infections, cervical stenosis, and some birth controls, especially IUD, they can all lead to painful bleeding. Now, what's the management protocol? Generally, most practitioners will use painkillers to manage painful bleeding. Some will use oral contraceptive pills, but there are certain lifestyle modifications you can adopt and you can actually get some relief. So you can use heating pads. You can use hot water bottle on your lower back or your belly. You can get some extra rest. You can avoid eating food that contains a lot of caffeine or pepper. Of course, you have to avoid smoking. You don't have any business smoking. You have to also avoid drinking alcohol about this period. You can also go for massaging your lower back and your abdomen. And when you exercise, you feel better. So these are a couple of remedies you can apply if you notice you have painful bleeding. But generally, management and treatment of painful bleeding is mainly with painkillers. Good example of painkillers are your NSAIDs, non-steroidal anti-inflammatory drugs, which is very common, like your ibuprofen and all those Feldene and all that. That's the drug of choice for treating pain during bleeding. So naproxen, ibuprofen, which you can buy over the counter, they are popular and they are used in treating pain. The reason is because they reduce the amount of prostaglandins. Remember, I told you guys that the prostaglandins are the things that will go and lead to contraction in your womb, which will slow up the endometrium and predispose you to having that pain. So when you take your NSAIDs and your naproxen and your ibuprofen, they will reduce the prostaglandins and you will have some relief. Thankfully, painkillers, majority of them are sold over the counter, so you can buy them over the counter. We can use hormonal contraceptives to also control painful bleeding. So we can give you birth control pills. You know, we can give you the pill, we can give you the patch, or we can give you the vaginal ring, and they can also help you to get some relief. So I've already mentioned heating pads, getting extra rest, avoiding food that contain caffeine, avoiding food that has a lot of pepper in it. Of course, avoiding cigarette smoking and drinking a lot of alcohol. And generally, when you exercise, you will feel better. Now, can there be complications of painful period? The answer is yes, depending on the reason why you're having the painful period. So if you have secondary painful period, that means there is likelihood you might have some gynecological problems. And they can also lead to infertility. Like if it's due to endometriosis, if it's due to PID, if it's due to STDs, endometriosis can affect your fertility, PID can affect your fertility, adenomyosis can affect your fertility. STDs can affect your fertility. So it depends on what's leading to that painful bleeding. So the answer is yes. Painful bleeding might be a sign you might have infertility. So it can be a sign, it can be a symptom. So any which way, we need to investigate it further, especially if it's something that just developed newly. So we need to keep an eye on all these signs and make extra efforts to get the help we need. The best person to help you if you begin to have painful bleeding that cannot be controlled with over-the-counter medication is your gynecologist. So if you notice that it's getting worse, for example, on a scale of 1 to 10, if your pain level is 10 over 10, then you need to go to the hospital, you need to go to a gynecologist, and we manage your pain appropriately. So that's my presentation. Now I'm going to give you an opportunity to ask your questions. So please go ahead and start asking your questions. We have about 6 more minutes. I'll provide you feedbacks. Then we can all go and get some rest. So if you have any questions, feel free and ask while I provide you the feedbacks. Thank you so much for coming. Any questions? Do we have any questions? Please feel free, ask. I'll provide you feedbacks. I'm not seeing anybody's comment. It's very unusual. Even COO would normally hop in. Let me check and see if COO is actually having some technical problems. Sometimes we do experience technical problems. So hold on, let me check. Okay, so there is no indication from COO. So if we don't have any other question, then probably we're going to end the clinic. And if you still have time, you can join me in Facebook and we can continue the conversation in Facebook. So do you have any questions? We're going to wait for a few more minutes. If you don't have any other question, then I'm going to exit the clinic. But just know that painful bleeding can be a sign of some gynecological problems. It can be primary painful bleeding, which is called dysmenorrhea. And it can also come with dyspareunia, which is, the pain you will experience during sexual intercourse with your partner. And you can have menorrhagia and all those other big words, which I'm not going to bother you guys with. Okay, I have a question. What if painful menses started at the earliest age of puberty? That's exactly what I'm talking about. If you started your puberty before 11, possibility you will experience painful bleeding is very high. If you've always had painful bleeding about that age, it's called primary painful bleeding. So hopefully by the time you give birth to your baby and as you're getting older, the pain threshold will reduce. So if you started having pain from day one, just about the time you're about to bleed and during your bleeding, and it's really quite an appreciable level of pain, it's primary. It simply means you probably have more prostaglandins in the cover of your womb. And when you have these prostaglandins in the cover of your womb, they will lead to contractions, which will slow off the cover of your womb, which is called the endometrium. And in course of doing that, they will lead to pain. Now, in that situation, we can give you ibuprofen or naproxen, which are non-steroidal anti-inflammatory drugs. So what they will principally do is to reduce the quantity of prostaglandin that is produced. And the more we reduce it, the more you're going to get relief. Now, be careful. Don't get addicted to painkillers regarding managing your pain. I know you will need some pain relief, but don't just get hooked up on taking pain medicine. You can get addicted, especially the narcotics, and you can have a serious medical problem. So try and run the pain by modifying your lifestyle, and hopefully the pain will let you be. You are 36, you are having painful menses, though you take a leave. So if this painful menses you're having is just about the time you normally have your menses, then it's primary. But if you notice that it's something that developed recently as you're getting older, then it's possible it's secondary dysmenorrhea. So what you need to do if you want to have a baby and you really get worried about this, especially if you have concomitant heavy bleeding, painful menses, painful defecation, painful urination, then it's possible you might have some pathology. You might have endometriosis, you might have PID, you might have UTI, and you might also have fibroids. Any of them can cause pain in that regards. Okay? So we still have time. So only NGCYN Onyi is in the clinic, and she's asking some very important questions. So do we have any other question, please? Is that all for today? So we're going to round up by the 20th minute mark. Once it gets to the 20th minute mark, we're going to end the clinic. Okay, so you can also hop in, join me in Facebook, and we continue the conversation. Normally in Facebook, we have bigger audience. Okay, so I'm just waiting to count down to 20 minutes, then I'm going to exit, and I'll join to Facebook immediately. Onyi, thank you for coming. I appreciate you. Remember to keep a date with us on the 24th. The 24th of this month is our super masterclass. It will be on multiple pregnancy. So multiple pregnancy is a pregnancy that will go beyond one baby. So twinning is the most common type of multiple pregnancy. We have triplets, then we have quadruplex, and other higher order multiple pregnancy. So once you have more than one baby at a go, it's called multiple pregnancy. So on the 24th, we're going to have a super master class. We're going to teach you guys. We're going to enlighten you. You get the knowledge you need so that you will know your potentials of having multiple babies. So my time is up. I'm going to take my leave now. I appreciate you coming. Thank you so much. I'll see you in Facebook shortly. God bless you and bye-bye.